We believe that combining the power of genomic data, behavioral data, clinical data, and social determinants of health, and generating the insights from all of these things put together is the wave to drive that more personalized, precise care, which then leads to better patient quality and outcomes and reduces total cost of care. When you think about the economics of a program like this, we approach it along 4 key value drivers. The first of this is, how do we become a distinctive platform of choice that provides innovative solutions that enable patients to manage proactively their health. That leads to new patient acquisition that obviously will be very accretive for a health system like ours. The second value driver is, once some risks are identified for these patients, we then are able to leverage our clinical and physician expertise to help these patients better solve those problems, and as a result, be part of their holistic health management and provide those services to those patients. The third is to do all of this in a way that reduces total cost of care. And this becomes particularly important for us as you think about our value-based offerings. We do have a substantial patient population for who we take risk. And as the community and the system transitions even more to value, that chassis becomes even more important for us to sort of reduce the total cost of care. Helix has been a fantastic partner, leveraging both their experiences at some of the other health systems that are innings or two ahead of us. They were very helpful in being good problem solvers all along the way. First and foremost, I think it would be good for you all to think about what are the key drivers of improving patient quality outcomes and reducing total cost of care, and how precision medicine fits in within delivering that mandate. Second, realizing that you're shaping the future of healthcare, that this is clearly a first step in a multi-innings journey. Third, I think making sure that all of the key value drivers are appropriately identified across new patient acquisition. How do you provide them in a continuity of care, optionality, and therefore become the platform of choice, reducing the total cost of care for those patients who are spending a lot out of pocket, and how do you leverage the research and data assets to both create a differentiated offering for yourself, but sort of really bolster a research infrastructure for the long-term future. Articulating all those value drivers and making sure all the business lines and service lines are appropriately educated on that. And finally, making sure that all the clinician network know the roadmap and are delivering to the milestones for the program's ultimate success.